Well, hello, everybody out there in Progress Report world. This is the first show of the year 2022. You know, when I was a kid, I remember reading a book called 1984.
Right.
It's kind of in the news now. And I thought, I'll never get there. 1984,
Right,
that's so far
1984,
off.
right.
Here it is, 2022.
Right.
And I'm still with my good friend Lou D'Alessandro because it's the first Wednesday of the month.
Right.
That's
Great
what
to
I
be
get
here.
for the reward of getting to a new year. I get to be with Lou D'Alessandro. And so we are on to the first show of the Progress Report for this year, 2022. And I could not be more pleased and proud to have as our guest tonight Senator Tom Sherman from Rye, New Hampshire, one of the very few members of our legislature, and I think the only member in the New Hampshire Senate who is actually a physician. And boy, if we need the help of physicians, we do now. I mean, we are into the second year. I guess we're almost getting into the third year.
The third year.
The
Yeah.
third year
Yeah.
of the pandemic.
It's
Who
awful.
would have thought when we started out, you know?
Yeah.
And it's just astonishing where we've got to and where we haven't got to with this pandemic. So anyhow, we're very pleased that Tom Sherman is with us. And one of the reasons I wanted to have Tom here, because of his credentials, not only as a distinguished state senator, who's done many good things, but also because of his expertise as a physician. And so with that, Lou, I thought I would ask Senator Sherman, because I was talking with my other co-host, Mike Farley, a while ago, and he said, we should do a show on how New Hampshire has responded to this pandemic. We've had, thanks to you, Lou, we've had several excellent shows with the wonderful people we have in our own Manchester public health system.
Yeah, we've been very fortunate.
Phil Alexakos and
Yes.
Anna Thomas. These are
Right.
just,
Both
I
terrific.
think, tremendous people
Yeah.
who've done yeoman work.
Yes.
But I wanted to get somebody who could talk about the state response to this crisis that we faced, along with every other part of around the world, but all over the United States, of dealing with this pandemic. So, you want to have at it?
Thank you. Sure.
And thank you for coming over, Tom.
Absolutely. Happy to be here and very honored.
Well,
So, where do you want me to start?
I would like to know what you think
yeah.
the state of New Hampshire has done right and where we've fallen short in addressing this pandemic from the top level of our state government.
Well, thank you for the question. And going back to the very beginning of the pandemic, we were all working in the same direction. And I think that was clear. When you start thinking about how did we respond in March, what was it, March of 2019?
Right.
Right.
That's when it was.
March 13th.
And actually it's March 2020, sorry. And in March of 2020, we knew this was coming. We knew, but we didn't know how bad it was. We didn't know how it was transmitted. We didn't know what kind of precautions people needed to take. And fortunately, we had really great resources within the state, within the Department of Health and Human Services. We had, Dr. Chan, we had Dartmouth Hitchcock, we had Jonathan Ballard, our commissioner, Lori Shibonette. Everybody was working together because we didn't know exactly how things were going to go. My niece actually helped work with the state to bring in some of our first airlifts from China because she was working at MIT and she was director of their China project.
Are you talking about bringing in the PPE, the
Yeah.
personal protective
Yeah.
equipment,
Right.
which
So-
I think Dean Kamen was very
Dean
involved in?
Kamen was very involved,
Yeah.
but my niece and I were there because she had so many contacts in China that she was able to get some of those shipments brought together. She actually offered to help the White House with the airlift from China, and they didn't follow what she had
Wow.
recommended. But the bottom line was, it was to use one of Senator Hassan's favorite terms, it was all hands on deck. It was the governor, it was the commissioner, everybody was working together in concert. We started a program called the Senior Support Team with the people from MIT to really make sure our nursing homes were fully prepared. And we had 70 nursing homes on board by April, and we ramped up so that we had over 120 volunteers when we first started to make sure the nursing homes were ready. It was everybody working in concert. The governor put in the emergency orders, many of which were so good that we put them into law. One of the areas where we have just leapt forward as a state as a result of COVID is in telemedicine, as Senator D'Alessandro knows very well. That came from a collaborative work. Senator Khan, Senator D'Alessandro, Representative Marsh, who is also a physician. And we actually have been leading the country in our availability and utilization of telemedicine. All of these things were a really incredible process that kept our numbers better. And when the vaccine came out, the rollout with the large super vaccination events, I actually volunteered at one of them at the Speedway. It was an amazing experience.
That was when they did the JJ.
This was, they had Pfizer and Moderna. It was, J&J had not yet been available.
Okay, I'm sorry. Okay.
Yeah, and it was cold, but the spirit of camaraderie was amazing. Somebody would come through if it were their birthday because we were checking birthdays. The entire facility, 8 lanes with about 6 vaccination sites per lane, all of them would start singing Happy Birthday in concert. It was an amazing experience. And we saw that our vaccination rate, and this was one of the most important parts that I think people need to understand. Up until the vaccine was available, what were we doing? We were masking and distancing and hand washing.
Right.
That was it. That was our armamentarium.
Yeah.
And that was where we really had to be fastidious. We had to be so careful to make sure that we didn't let the virus spread because we really had no big defense. The vaccine came along, and what we saw in the state of New Hampshire, it's actually on the DHHS dashboard website, is you saw as vaccines went up, COVID plummeted. And we peaked as a state at about 56% of the population vaccinated. And that was before the children's vaccines were available. So what we then saw was we were doing so well. We made it through that first summer. You know, I'm down at Hampton Beach, is one of my big constituencies. Incredibly innovative work by our Chamber of Commerce under John Nyan, who is also on the reopening task force for the Gopher. We made it through that summer. Businesses were able to move forward with Main Street and the different funding that came, mainly because our federal delegation was so effective at making sure that New Hampshire was well supported. That was Jeanne Shaheen, Senator Hassan, Congressman Pappas, and Congresswoman Custer. They did yeoman's work to make sure we had all the resources to keep our businesses alive. But then, with this curve showing how well we were doing, the governor allowed the state of emergency to lapse at the end of May, early June of 2021. And what we saw after that was that the vaccine curve basically was flat. And when somebody is not vaccinated for COVID, there are several things. One, if they get COVID, it's going to be much more severe because we all know that vaccines aren't perfect. All of us who have gotten the flu vaccine have gotten the flu. But it's typically milder.
Right.
And that's what we've found with these vaccines, is that the actual vaccinated patients, if they get sick, it's going to be milder. They may not even have any symptoms.
Right.
But the ones that are unvaccinated
Right.
are really at the highest risk. They're not just at risk of getting sick. They're at risk of carrying the disease, communicating it to their children and other people who can't be vaccinated. And then finally, they are like a giant petri dish or culture dish for that virus to change.
Yeah.
So when you look at where the Delta variant and the Omicron variant came from, it's typically in countries where vaccinations are fairly low and the virus is able to mutate. So in June, what happened was we took our finger off the pulse.
We took our foot off the accelerator.
Took our foot off the accelerator. And all of us were concerned.
Yes.
We saw that vaccinations shifted to pharmacies, no more big vaccination events. We had really good evidence that the best way to get populations of people who aren't vaccinated who are reluctant, is to have trusted advisors, clergy, doctors, people in the community leaders, really talk to them and do outreach. Go to the communities, mobile vans, those kind of things are the way you get that curve moving up again.
Yeah.
Early August was when Delta started hitting the United States.
That's the one that really kills you.
Yes, it's more virulent or more contagious, and it's more severe. And that was when I had a discussion with the commissioner. We talked about, my concern was that Delta was going to be ramping up, and we didn't really have a lot of on the ground resources, and our vaccine curve was flat. The real problem in the state of New Hampshire.
Well, did she agree with you about this?
She did, and she actually told me about plans to put in more mobile units, and we talked about reaching out to communities, especially lower socioeconomic communities or communities of color or communities where there was just a sort of a cultural distrust. I've kind of broken down the unvaccinated into subgroups. One is people who can't. It's either religious or medical, but they really can't be vaccinated.
Or they're too young, or maybe.
Back then they were too young.
Yeah.
The second group is a group that culturally they just don't trust that these vaccines are effective, and that's where you have to put in that intensive effort to really help dispel that mistrust. Third is a group, and I have several friends in this group who just say, "Yeah, I'll get to it," and there are several of those.
Not a priority.
Not a priority. And then the fourth is the group that's very vocal and very active in the state of New Hampshire, who believe that, who have bought into a lot of misinformation about vaccines and are spreading this misinformation in a way that's actually hurting people. And that's something that I think they are driving a lot of the politics of this, but they should not be driving the policy. And so that's what happened in September. And Senator D'Alessandro knows very well what happened with the fiscal committee.
I think you make an excellent point when you talk about that last group. That last group of individuals evidently manifested a great deal of power, to be honest with you, because
this is the free staters.
This is the free staters, the extreme group.
Yeah.
And this group permeated the legislature. All right.
And school boards.
And school boards, but the legislature and the power to drive what was happening with the legislature with regard to the acceptance of the federal money. So we committed, to me, the most grievous action of all by rejecting the money initially. The $22 million was rejected.
At the Executive Council.
The Executive Council. Pressure put on the Executive Council. Never should have been at the Executive Council. Should have been at the Fiscal Committee first. But it goes to the Executive Council, then comes back to the Fiscal Committee. It's tabled at the Fiscal Committee. Nonsense. Absolute nonsense.
Well, remember what was happening scientifically at that point. Because in September, we knew that boosters were going to be coming, and they came. The approval for a Pfizer booster came in late September. And the second one that was coming in October was going to be the approval for children to get vaccinated. That delay that you just described, that delay is what put us behind the curve.
Right.
And I really don't believe there was much leadership from the executive branch at all, which is headed by the governor, on this. The Executive Council voted it down.
Right.
And there was just,
really.
No huge amount of leadership. And what happened in that vacuum is we lost 2 months.
Yeah.
And those 2 months were boosters. Those 2 months were vaccinating children. And that was enough because the whole time Delta was growing exponentially in the state. The other thing that we have done more recently that I think is really important to understand is that when somebody is hospitalized, they are only counted as a COVID patient in the hospital for the first 10 days of their hospitalization. It underestimates, per a public disclosure by one of the hospitals, they believe it underestimates the number of COVID patients who are inpatients in the state by over 30%, which is huge when you
Huge.
think of our hospital
Huge.
burden. And Lou, you visited CMC, isn't that right?
I was at CMC earlier this week. Went through CMC and met with the nurses, met with the doctors. Senator Hassan was there, obviously, to get their take on what was happening, and the hospital's full. Now, it's hard for me to imagine this, but there were people who had 100-day stays in the hospital. One person,
Right.
200 days in the hospital.
In
That's,
ICU or just not necessarily?
well, they start in ICU and then they move them
Yeah, okay.
to the hospital, but to another setting in the hospital. But indeed, the emergency room is full. They were creating additional space because of the demand. But indeed, hospitals function like an ordinary business functions, and you need a cash flow situation. What produces that are the elective surgeries.
Right.
And if you have to shut down elective surgeries, you know what, as a physician, you know what that does to the scope and the functioning of the facility. And in this case, you got a 25% vacancy rate because you can't fill the jobs. You can't have the elective surgeries, but people are working 24/7 on the patients that they have there. They're trying to give them the best service, and they're seeing people die, Tom, which is a terrible
Well,
situation.
I think, Lou, there's
Terrible situation.
one more word that needs to be in what's happening to healthcare workers. Healthcare workers are seeing people die from a preventable
Yes, exactly.
illness.
Oh, exactly.
That's the part that is really driving this huge distress in the healthcare worker population at every level.
Yeah.
They are being put at risk themselves
Right.
because they are having to take care of people who are contagious.
Yeah.
They are also having to take care of people who did not get vaccinated.
Yeah.
And the large proportion of people, both in New Hampshire and nationwide, who are sick right now and filling our hospitals and dying,
Right.
are people who did not get vaccinated.
Yeah. And
You know, Tom, I think you kind of touched on this, but I'm going to just come back to it. For a long time, New Hampshire and northern New England generally, but particularly New Hampshire, seem to be doing about the best in the whole country in dealing with COVID. And all of a sudden, we've arrived at a point we're not the best, we're among the worst in positivity rates. What is the cause of that?
My feeling is that we had strong leadership up until June 1st. After June 1st, we had virtually a vacuum in leadership. We didn't have somebody at the helm who recognized that this is a virus that likes to change. It likes to get either much more contagious or much more severe, all of which puts our businesses at risk, our hospitals at risk, our entire health system at risk, and most importantly, the health and even the lives of New Hampshire residents at risk. And if that had been recognized in June, if that full court press had been continued, we may not have even had anywhere near the surge that we had from Delta. Remember, right now we're starting to deal with Omicron. But Delta was the one where we had that 2-month delay
right,
that
right.
Senator D'Alessandro described. And that 2-month delay really completely hamstrung our Department of Health and Human Services. You can't blame them. They didn't have the funding. And so if the fiscal committee and the executive council block funding, we were the only state in the country to do it, by the way. Am I not correct?
Yes, that's correct.
If you block that funding, you end up with a situation where you are completely unprepared. I've said that the analogy I've used, which I think is really on target, and everybody understands this, is imagine you're in the middle of a hurricane and you're trying to put plywood on your windows. That's where we are. And, we've had one booster blitz. I worked it. It was awesome. It was a great effort. Everybody was working together. We have another one this Saturday. That is 2 booster vaccination clinics. In how many months have we known about this?
Yeah.
That's it. And we still have a very high percentage of unvaccinated people.
We do.
We have no idea of what the actual number of people who are testing positive, because so many people are testing at home.
Yeah.
But we are also underestimating the number of people hospitalized.
Right.
That patient that Senator D'Alessandro described, 100, 200 days, after the first 10 days, they're not a COVID patient
Right.
on our books. But they were there because of COVID.
COVID.
Their lung disease started with COVID. I'd also, if I could just say one more thing, which
Please.
is really, or a couple more things. One is the people who are acting like vaccines or are feeding this misinformation probably forgot about polio.
Yes.
Yeah.
They forgot about measles.
Right.
They forgot about diseases that maimed children, killed adults.
That's right.
And
Oh, I
In
remember
my-
polio.
in my whole career, I have never seen anything in the science of medicine. It's been, for the virologists in the world, COVID has been the moonshot. The fact that we have an effective vaccine within a year or two of the onset of the illness is beyond amazing.
It is.
Yeah.
Truly
And
is.
that vaccine is safe.
Yeah.
It's available if you want it, or it could be more available. And it's now approved in children. And you say, well, children don't get really sick. A percentage of children get really sick.
Sure.
Sure, some of them
And
do.
if you have enough numbers
Yeah,
of people,
Right.
you're going to have an awful lot of children getting sick. And so vaccine is our way out of this. And in the meantime, while we're in the middle of COVID, I came here with a mask on. I'm sitting far enough away from you guys.
I hope so.
I'm double vaccinated, I'm boosted,
Me too.
and I'm still going to put my mask on when I leave.
Yeah.
So masking is critical. We should allow our businesses to determine whether or not
Yeah.
they're going to have mask mandates.
Yeah.
That's up to them. And we need to continue to be vigilant. That's how we get out of this.
Yeah.
Oh boy, so well said. I had a long talk with Anna Thomas just yesterday because we were told that only 50% of the people in Manchester have been vaccinated. She says that's
Really?
Yeah, she says that's not really correct because the information that funnels into the database has been miscalculated or misconstrued. It's more like 60%. But indeed, that's awful.
That is awful.
When you think of it.
We need to be 80%.
Yeah,
better.
we need to be 90% or
Yeah.
better. And it's available. I mean, there's no question about the availability of vaccine. It's here. The Pfizer vaccine, the Moderna vaccine, the Johnson & Johnson vaccine, they're all available. The booster shot's available. I mean, just make your appointment and get it done. It's the naysayers that have become so vocal. And for some reasons, the lie has become even more severe, and more people believe it. And I just hate to talk about the fiscal committee again, and the document that Kenny Weiler circulated. I mean, Kenny Weiler's a good guy. I've known Kenny Weiler for a long time, but to circulate a document like that, with the that wasn't information. That was trash.
Well,
Absolute
it wasn't
trash.
true.
Oh, no,
And
there was no
that's-
truth to it at all.
And that's continuing to be,
It is. It's continuing to be believed by people.
I don't know if you remember, Lou, but last year when we had a number of the bills coming forward in the House and in the Senate with trying to put into question whether people should be vaccinated, whether there
Yes.
should be. They brought in doctors from all over
Right.
the country. One of the doctors that actually testified had lost his license in Maryland and was held responsible for the outbreak of measles in the Orthodox Jewish population that he cared for in New York City. That's the people, not one New Hampshire physician or nurse, qualified and experienced nurse, got up and said, this is not the right thing to be doing. And the danger, as you know, and I think you do too, Representative Backus, the danger is that the goal of some of the people in this group is to completely undo our public health system that we've spent the last 2 decades building. And that includes, well, all you have to do is look at the bills that have been filed in the House.
Yeah.
And if they are successful, we may lose something as fundamental as required childhood vaccines to attend public school.
Oh my goodness, that is appalling.
So
Well, it's
that
scary.
is
Scary.
that is the concern. And as a physician, remember there's one person who's being helped by a vaccine, that's the vaccinated.
Right.
But the other person you're helping is your neighbor, your
Sure.
family member, your community
Right.
member who can't be vaccinated.
Yeah,
And by you being vaccinated, you're protecting them.
yeah, that's something I think that's entirely too often forgotten.
Yeah,
If
it
we'd
is.
done everything the way you think we should have done it, do you think we'd be in a better place now?
Absolutely.
No
I have
question about
no
it.
question about it.
Right.
And I think, but I think we can still do better than we're doing. I'd like to see the governor set up the super sites, many more. You know, the demand is there. They're already full pretty much for this Saturday. All of the slots are taken. I had a mother come up to me at the last one where I was working, and she said, I can't get my children vaccinated. I can't get an appointment to get my children vaccinated until mid-January.
Yeah,
And that was early December. And she was coming into the holidays. Remember, typically, the virus lags in terms of numbers of people impacted by a week to 2 weeks. So we've just gone through Christmas and the holidays and New Year's.
Yeah.
And the trajectory that the CDC predicts and that I think our own health department predicts is that we're going to see this worsen before it gets better.
Yeah.
Really?
Yeah.
And so
yeah,
so we really
covered.
have to continue to be vigilant. If I go to the grocery store, I'm always wearing a mask once I'm inside.
but lots of people in the grocery store are not.
No, they're not. And they're putting others at risk, and that's the thing to understand
Yeah,
about masks.
yeah.
Easy.
Can you talk to us a little bit about testing? I mean, that's the big thing these days.
Yes.
I was feeling a little off today, so I did my, home test. Came back negative. You'll be happy to know, and I was
Good.
extremely happy to know. But can we really count on these things, and how important is this to our overall effort to beat this?
Well,
horrible-
testing is critical, especially when we don't have vaccines. Remember, we had testing before vaccines. So if you remember early in the pandemic, we used testing and case tracing each positive test as a way to fight COVID. At this point, testing is really critical to make sure that if you're positive, you're not going out in public.
Yeah,
There's new CDC guidance, which I think is pretty confusing. But if you want to,
It is a little confusing.
Yeah, if you want to break it
Yeah.
down, if you test positive, you need to stay quarantined for 5 days.
yeah,
If you never have any symptoms, you can go back out after 5 days.
with a negative test, right?
No.
No.
You can go back out with, the CDC says you don't need to have that test.
Oh, really?
But you do need to wear a mask in public.
Yeah,
There are people who say, no, we should have a negative test. I think with the CDC recommendations, I like the idea of testing before. If I were positive and 5 days later I'm still feeling great, but and I'm ready to get back out in public, I think it might be a responsible thing to do to test before you go back out. But that's not the CDC recommendation.
So are these home tests that we do, and which I did for myself today, can you rely on the results?
If you have symptoms and you do a home test, in other words, for example, Omicron is really staying above the lungs.
That's good news.
So
Yeah.
it's
We don't
sore
want the
throat.
lungs involved in it, right.
Sore throat, runny nose. It's more like your common flu symptoms or cold symptoms. That's Omicron. It's not everybody. There are people dying of Omicron, by the way. So
Really?
we have to recognize that when you say these are the common symptoms, that doesn't mean they're the only symptoms. But when you think about Omicron, you come in, say, for example, I wake up tomorrow and I have a sore throat, runny nose. I'm not going to go out in public without testing myself first. If I have symptoms and I do a rapid test, that's a home test, and that's positive, that's really pretty reliable. If it's negative, it's pretty good if I have symptoms.
Okay.
If I don't have symptoms, it's not quite so good. And
But
so
still,
you may
still not worthless.
still not worthless.
Yeah.
But you may want to go and set up a PCR. And actually, just so your audience knows, the state has arranged for the availability to have PCR testing at home. Dr. Ballard sent me all the links. They're on the DHHS website. And this one, they'll overnight the test to you. You do the test at your home, and you overnight it back to them, and you have an answer within about 24, 48 hours.
Wow.
The downside of all of the testing right now is that the PCR testing, there's such an overload of it that people who need it in 2 to 3 days are actually not getting it for 3 to 5 days, getting the result.
So what do you think about what the CDC is doing for us? This is supposedly our premier public health organization around the world, and they're taking a lot of hits. Is there guidance? I'm hoping it's well science-based, but is also clear and helpful to people?
Well, it is science-based. It's the best guidance that's out there right now. And the fact that it's changing so much confuses people.
That's right.
But it actually means two things. Number one, the science on this virus is changing fairly rapidly itself. And two is that the CDC is trying to keep up with the science. I was reading some journals that had to do with the Journal of the American Medical Association, the New England Journal of Medicine. You look at how many articles have been published, scientific, peer review, excellent articles have been published on COVID. It's astounding how many. And the CDC's job is to keep up with that and make sure they're projecting the best recommendations based on the best science.
Are we supporting them the way that we need to? Are we supporting public health in this country the way that we need to?
No. And the reason we're not is because this whole effort has been politicized and fueled with lies and misinformation.
Ideologues.
Well, I don't want to call
I have a piece coming out in the Evening tomorrow. You'll enjoy it, Lou.
Yeah, and I have some very good friends who are very smart people who believe some of this stuff that they're being sent. And we just have to continue to work to help them understand that this isn't about them. It's not about personal freedom. It's about personal responsibility. When I first moved to New Hampshire, one of my closest friends has lived here all his life. I will forever be an outsider. But,
We forgive you.
but a friend of mine who's lived here all his life, grew up in Nashua, very, very smart guy, has his finger on the pulse of New Hampshire. He said, if you need 2 words to describe New Hampshire, it's personal responsibility. It is not personal freedom. It's personal responsibility.
I'm not so sure about that anymore.
Well, that's my mantra for the way I work and the way I work with people from New Hampshire. And I think the vast majority of the people of New Hampshire get it. They understand that this isn't just about them. This is about their neighbors, their family
Well,
members.
one would
their
hope.
loved
One would hope.
Yeah, one would hope.
Absolutely.
But I think if we've lost anything, it's what you've articulated. We've lost that.
But we can get it back, Lou.
Well, we've got to get it back. We've got to get it back. And I think one of the things that's really missing is that caring for one another. That's really disappeared.
Yeah.
And I live in a neighborhood. I've lived in the same house for 50 years. Okay, we built that house 50 years ago.
Yes, sir. They
So
did.
I got the same neighbors that we've had for a long period of time,
And the same wife, might I
and the
say.
same wife,
Which is
and
a
the same-
terrific
yeah,
lady.
well,
Wonderful wife.
Yeah, she's the best.
She's
thing,
the best.
But
my
my neighbor across the street, Dickie Boucher, God bless him, he's the best. When we leave, he watches the house. When we go away, he gets the mail. if the snow's too steep, he'll come over with the snow blower and help us blow out. That neighborhood concept, that's missing. Now, this child that disappeared is in my neighborhood. In my neighborhood, where, as I say, I've been there 50 years. But in the recent past, Tom, we've had a drug bust. They got drugs, guns, and money. This is 2 streets over. Now this child disappears. These are things that we never saw before because we did have good neighborhoods, people caring for one another. That's disappeared. We've got to restore that in our society, caring for one another. I think if I could in my lifetime do one thing, it would be to kind of make that happen, make more people conscious of the fact that caring about one another is the best thing that we can do in this world.
Yeah.
Yeah, and
Goes back to the early days of Christianity too, doesn't it?
Well,
it's also, it's I think we share a guiding principle in the way we work in Concord. As a doctor, I don't order a test because I love LabCorp. I don't order an X-ray because I like Siemens.
Right.
I order a test or an X-ray because that's what my patient needs. I hold them up highest. When I'm a state senator or when I was a state rep, and I know this is true of you, Lou, so I'll speak for you. Your constituent is the only thing that matters.
Yeah.
And that is, and that makes it a really easy transition from being a doctor to a state senator.
Yeah.
And always keeping that focus, and you won't go wrong. In your neighborhood,
yes.
it's not about the snow. It's not about cars. It's not about, it's about each other.
Right. Exactly.
And that's one of the things that attracted me to New Hampshire in the first place.
Yeah.
Well,
So how long have you served in the legislature?
Well, I like to joke. This is my 10th year with a 2-year sabbatical. So, I lost in 2016.
We're lucky that people like you and Lou want to do this service. I just think there's no question about it.
well, this is the 50th anniversary of my election to the legislature.
No kidding.
my
Yeah,
word.
50 years ago.
50 years ago?
50 years ago. Bill Gardner and I were elected in 1972.
And you were a Republican back then.
I was a Republican back
And
There
then.
was
you're
a
out-
different Republican Party back then, too.
And I'm still there.
Just want to point out that you're outlasting Bill Gardner.
well, Tom, I had him as a student when he was 13 years old at Bishop Bradley High School, and had him in civics. And we could talk about Billy, but he's done a great job as Secretary of State.
I would like to get him to come back.
Oh, he's got to come back.
You got to
Yeah,
inform him
okay.
to get back.
But
I burned my bridges with him. I'm
Tom,
afraid.
we're the only 2 left. The
What do you
only
mean?
that started in '72.
Wow.
The
You
only
and
2
Bill
left.
Gardner?
We're the only 2 left in the legislative process.
that's
And everybody
interesting.
else has either retired or left us.
There's a lot of history there, for
There's
sure.
a lot of history. But
Let's go on to something else, shall we? Or do you
Well,
have anything?
could we just
would like to-
give
I
give
think what you
kudos-
said is really terrific.
Yeah, but give kudos
Terrifically informed,
before we
insightful,
leave.
and useful.
Give kudos to Dr. Chin and Dr. Ballard. I call Dr. Ballard. He's right there.
He is.
He is right there.
Yeah.
And that's a public servant also. I'm sure he could be doing better if he were in public practice. But he's there. He answers the phone. He returns phone calls. That's to me one of the great parts of New Hampshire is knowing that person. And we've lost a little of that, but he's restored my confidence. And
Well,
I would give him a kudo.
I would like to add a kudo, and throughout all of this, the courage that Representative Dr. Bill Marsh has
Yes,
shown.
yeah.
He is
That
one
was
of
really stunning.
Yeah.
he is one of the smartest docs I know. He really can articulate this. We did an op-ed
Yes, I saw
yesterday.
that, yeah.
And
Oh, really? Is that
anybody
going to appear soon?
It's out. So it's.
Okay.
But that really outlines what we think we need to be doing in the future to really get this under control. We're willing to work with anybody to get it done. This isn't political. It's not partisan. And the governor thought it was silly. I don't think anybody's lives or health is silly. So, I'm willing to work with anybody to make it happen. And so that's
Excellent,
where we can go.
excellent.
But if you want some more specifics, it's in that op-ed that's in the paper.
Would you appear tomorrow?
No, it actually was posted yesterday in Seacoast Online. It's going across the state. So
I hope so. Well, great. Well, you've been terrific, Tom, and we're so blessed to have somebody with your skills and experience and good values to be speaking out on these issues. But let's talk about the Senate redistricting. Ooh, they want to take Goffstown away from you.
They're going to take Goffstown. It took me
I
20.
don't know if I can accept that.
Well, it took me
Goffstown's
20.
my hometown.
Yeah, it took me 20 years to get a foothold in Goffstown, and the Goffstown people have been wonderful to me.
They certainly have, and you've been wonderful to them.
Worked very hard to get them. But the redistricting. Now, Tom, you're one of the big beneficiaries of
it's
They
funny.
like you.
Well, I've practiced in Exeter for the last 10 or 12 years, and all of a sudden Exeter is one of my towns. So I know it very well. I'm very comfortable with working with Exeter, and I think it's a great. It'll be great for that district. On the unfortunate side of it, though, my district was gerrymandered in 2011. It was meant to have a Republican in that seat, and thanks to the people of my district and the good relationship we've built, I've not only won there but been reelected.
On your behalf.
And I've enjoyed every minute of it. I've met some really wonderful people. I actually am very sad about the loss of the towns I will be losing. In Seabrook, I just love the people of Seabrook. I've had a great relationship with many of them. So hopefully, just because they're not in my district, I'll stay in close touch with them. But what it does
Hey, here's a little thing about Seabrook. Did you know this?
What's that?
There's a lot of people that think that Seabrook was the real inspiration for Al Cap's dog patch.
Well, he lived there.
That's what I understand.
Yeah.
Well,
I said that once, and I'm not sure the bookies really appreciated that.
Well,
but that's what I
It's
understand.
a great town. They've got some really wonderful people. And among the richest history in the state is the history of Seabrook, especially early Seabrook. And many of those families are still there. You know that, the Eatons and the
Browns.
Browns,
Yeah.
Bruce and his family, and Ella.
They own the town.
Yeah,
They own
yeah.
most
And
of
the
land.
Boyds.
They own. Well, yes, Seabrook. But the real hit came to Kevin Kavanaugh.
Right.
I mean, here's Kevin, lives in Ward 1. He had 1, 2, and 12. He gives them up. One remains in the district, but then he picks up Goffstown and Raymond.
Yeah.
Tough.
That's tough for him.
And Gaida, Senator Gaida, he's gone because they took his town out of the district. But I think he said he was planning to move.
He's going to
anyway.
move. Yeah.
He's going to move into the other district. Look at Khan got Peterborough. That was a gift. That makes an unbeatable situation more unbeatable because he picks up a very.
But what these do, the gift that Senator Khan and I both got, actually then turns the remaining district into an unbeatable, solid Republican district. And I don't know about you, Lou, but when I think about voting, we worked so hard with the 2020 election. I was on the Bill Gardner asked me to be on the select committee. We worked incredibly hard to make that a robust, safe election, and it was. It was one of the best turnouts in the history of the state, if not the best. But when you gerrymander, those votes that have been gerrymandered don't count. So if I'm a Republican in Portsmouth or a Democrat in Salem or a Republican in Peterborough and a Democrat in Goffstown, all of a sudden my vote may not count.
Right.
And that, to me, you can put all the effort you want into making a vote safe and secure, but if it's meaningless, we don't have a democracy.
Yeah. I'm very, very, very worried about the fate of democracy in this country right now.
I don't think
I
there's
mean,
any
I just
question.
think it's. I think
Judge
Absolutely.
Broderick wrote a beautiful column
He did.
on that.
He did.
Well, I think.
And the most recent Atlantic that I just got, I mean, everybody should read that. I mean, it was just
Well, I think
just appalling.
The status of democracy is questionable.
You know, and
it's questionable.
Trump has been out full-throated endorsement of Viktor Orban as the autocrat of Hungary. I mean, it tells you everything you need to know.
Yeah. It did so.
Tom, when we came in here, we usually take a couple of breaks. We're going along really well here. You wanted to talk a little bit about the status of our mental health care system in the state of New Hampshire, which is something, you know, that my good friend John Broderick cares a lot about, who you just mentioned.
I've been to many. I can't quite recite his presentation by heart, but I still tear up whenever I go to hear him speak.
Yeah, because he has a very personal experience with a mental health
He
crisis
does.
in his family.
Yes, very
Of course. So you want to talk a little bit about that? Where are we doing? I mean, there was a time, and I remember because it involved my own family, when, you know, we were warehousing people in thousands at the New Hampshire.
Yeah, we had 3,000. We had 3,000 residents. 3,000
3,000
at New Hampshire Hospital.
It was, as the expression goes, bedlam.
Oh,
it was bedlam.
Bedlam. Well, I was on
And
the
you know, and
executive.
then we became a national leader in
The
breaking that up
institutionalization.
and going to community health care.
Yeah.
And it seems like things haven't been going all that well since.
They're falling
Yeah,
apart.
you're absolutely right. We had the majority in 2018 and 19, or 2019, 2020, and we were able to pass multiple pieces of legislation that really were designed to make a big dent on the issue of ER boarding. ER boarding is where somebody is in mental health crisis.
Yes. And they're stashed in the emergency room
And they
somewhere.
arrive in the emergency room, and the state doesn't have a bed for them, so they sit there.
Yeah.
I had a bill, SB 11. Senator Feltus had a bill, SB 14, that Senator Feltus and Senator Whitley worked on very closely. These were breakthrough bills to really make this happen. And the Republicans in the Senate at the time, when these bills were coming through, said, well, we already did this. The key difference was that they never funded them. And that,
Somehow not shocked.
and so in 2019, in SB 14, there were, I believe, Senator D'Alessandro may remember the number, but it was about $20 million was attached to that. And SB 11 had $11 million attached to it. And then the budget was where we really launched this notion of mobile crisis teams and really putting this forward. And by the way, this effort was not just Democrats. It was Democrats with Republicans, and the governor signed these into law. Eventually, when the compromise budget came through in 2019. The key, though, was from the passing of the budget to fiscal 2020, $5 million of that allocated funding was allowed to lapse. And thanks to Senator Whitley, she was able to get a bill in to keep the remaining $20 million from lapsing. And lapsing means that the money that was allocated to actually accomplish that goal disappeared because it basically time ran out. And so where we are right now, the governor, unfortunately, in his 6 years in office, we have not seen a lot of movement on all this until the Democrats really got in power, in the majority. And then he jumped on board, and we were able to actually get a good, solid foundation. The other part of this was what's called the 10-year plan. Now, there was a 10-year plan in 2008. You may remember that 10-year plan. When the next 10-year plan came along in 2018, nothing had happened with that 2008 10-year plan, and that was because there was no funding behind it. So the 2018 10-year plan, I put in a bill that actually holds them accountable to actually implementing that. And it is moving forward. Thank the Lord it's moving forward, because last February we had 51 children boarding in our emergency rooms with no place to go, no services, unconscionable. And it was something that we all came together again to try to address this. But part of the reason for that is that what was passed in 2019 was not implemented. So finally, all of that is starting to be implemented. We are starting to make progress. But just today, There are over 20 adults in the emergency room in mental health crisis and 4 children
And meanwhile, our emergency rooms are being overwhelmed with
with COVID.
COVID, and
Yes.
people arrive but then get diagnosed with COVID. I mean, it's just astonishing to me how stressed out our health system is.
So the bottom line is that we have the foundation, thanks to the budget and the work done in the 2019-2020 biennium. We have the foundation, the way to do it, we have the money to do it. We just have to have the leadership to keep the ball rolling and keep the momentum moving forward.
Well, we certainly have the money, and we've had the money for the last couple of bienniums. I chaired finance when we funded all of those bills.
You did.
And what happened is, because of the COVID situation, that money was allowed to lapse.
Yeah.
And the lapse was around $100 million. It was over $100 million.
Right.
And programs that we had paid for, authorized and paid for, never happened. They never stood them up.
Yeah.
Right.
That's a tragedy. There's a real tragedy.
It is a huge tragedy.
And when you have lapses of that magnitude, remember, because of that lapse and that money left at the end of the biennium, it went into the revenue stabilization account. So the revenue, the rainy day fund grew. It's like almost $260 million now, where those monies should have been spent in the areas that the allocations
Well,
were
between
made.
COVID, the mental health crisis, and the opioid crisis,
Which hasn't gone away.
which has
No.
it's actually gotten
No, it's gotten worse.
during COVID.
Yeah.
I can't think of a more important priority right now. Our businesses are actually recovering. We need to allow them to do what they do. We don't need to be telling them they can't vaccinate, they can't have mask mandates. We have to let the businesses alone. Let them do their work. They're great at it.
So you don't think
But-
we should impose any mandates on businesses?
No, I think let the businesses decide what's best for them.
Okay, don't prevent them from doing
Don't
it.
prevent, but that's my point, is we have bills right now coming from the Free State that would tell businesses they cannot do any
can't do it.
mask or
Yeah, that
vaccine
seems
mandates.
entirely inconsistent with their whole
And,
ethos.
and the people who are pushing back against that aren't just people like me. The BIA is actually doing
Yeah,
a full
yeah.
press to make sure that businesses are left alone in all this.
Yeah. So I have to ask you, Tom, there's been plenty of mention in the press about you may be seeking higher office in the state, maybe governor. I don't necessarily think I can convince you to declare your candidacy here. But would you like to opine on that? I think you've had a very distinguished career as a physician and as a legislator, both in the House and the Senate. What are you thinking of the future, maybe?
Well, I can't think of a more important time to have somebody with medical expertise in the corner office at the State House than in the middle of a pandemic.
How many of our governors have been doctors, or
None.
are doctors now?
Well, I could
None
think
that
of
I
one.
know.
Oh,
None?
Dr. Blood. Dr. Blood used to have office hours in the executive
Oh, did he
council
really?
chamber. Yes.
Well, that's a while ago, right?
Yeah, it was a while ago.
You
but,
would remember that.
Dr.
Lou.
Yeah.
Yeah.
Yeah, I know we've had them in the Senate before.
Yeah.
And in fact, I met my predecessor, who was just a wonderful, wonderful guy. Did great things for New Hampshire. But in terms of the timing, we have a mental health crisis.
Right.
We have a opioid crisis. We have COVID. We have many other issues that our current governor has had anywhere from 2 to 6 years
To deal with.
to get us on the right track, and we're not. And so I would love to see a strong candidate come forward who can really fill that void and help us not only come out of COVID strong, but stronger.
Yeah.
And the other part that I think is a major message is that New Hampshire, and I think Senator D'Alessandro knows this better than almost anybody, we have not been a place where we can't come together and do what's right for the people of New Hampshire. That is a new phenomenon.
And that's getting harder to do now.
But I believe that having a background of healing,
Makes
of
sense.
being able to be nonpartisan, being able to look at both sides and see both sides, being able to listen is something that is long overdue for the corner office.
Well, I think it's a real tribute to you that you were able to come together with Representative Bill Marsh, who was a member of the Republican caucus, and came over to you because he did not think the government and leadership was doing the right thing in addressing this, particularly this COVID thing. I mean, that was really a kind of a stunning development, because,
very stunning.
yeah, that was quite amazing.
Yeah.
Yeah. So, well, okay.
Well, it presents a vision of hope.
It
Right,
presents
we
a
got to
vision
be
of
positive.
hope.
We have to be positive.
And
this new year.
we haven't talked about the fact that you guys are both up there in the House chamber, not in the Senate
Right.
chamber, because you could make distancing,
Right.
necessary distancing in that vast House chamber where there's normally 400 people sitting cheek by jowl,
Right.
which is not happening. They were all down at the Doubletree Hotel here in Manchester. Got any thoughts on how that first day went, and whether you have any sense of optimism about what this session may be?
Well, I think it went as expected. One of the parts that is troublesome to me is there were at least two bills that, if they weren't quite so extreme, I could see the merit in them, and I could have supported them. But it's this shift so far to extremism, and some of this is by people who I've had tons of respect for, have worked with the entire time I've been in the legislature, that is disturbing to me. And but we still remain colleagues. We still talk. We still respect each other, and I think that's the hallmark of the Senate, is that we can work together. And as the Senate president likes to say, he says, look at the percentage where we agree and disagree. And the percentage is much higher on the side where we agree. So I
But
think,
those aren't the important issues, are they?
well, some of them are very important, but some of them they're certainly not the divisive issues. And so I'm very concerned that we will go farther to the right, to the extreme. I am very concerned that we will put some of our most important institutions at risk in the state of New Hampshire. And that's what I'm going to push back against the most, is to make sure we hold on to what keeps the people of New Hampshire safe and keeps them healthy and keeps our businesses healthy.
Yeah. Lou, would you like to weigh in on that?
Well, yeah, I think there was one bill today that we should have passed, and I'm very sad. That was the unemployment compensation situation, where the federal government charges interest when they make the mistake. They make the mistake. It's a 1% interest, but the interest compounds.
That's the state government does that.
And state government does its best to correct those errors, but at the federal level, those errors look at the size of the situation, so the errors are more frequent. But indeed, we could have corrected that today.
Well,
very easily.
and during COVID, that was one of my most frequent calls, was people saying, I'm waiting for my appeal.
Right, I'm waiting.
They're telling me my appeal won't be heard for 3 months, but in the interim, they're being charged interest that's compounding the entire time.
Right.
Yeah.
And they have absolutely no control. And these are people who are unemployed, so they also don't have much of an income.
Yeah.
Well, it was just it was purely a nonpartisan issue. It should have been easily done with.
Yep.
Easily done with. And I'm sad that I didn't work harder on that piece of
Well, you worked
legislation,
hard on a lot of
because I
stuff,
thought, well, I thought that we had the votes.
Right, I thought we had the
I thought
votes,
we had
too.
the votes, and all of a sudden we don't have the votes, and that's just bad. That's just bad government, to be honest with you. That's stupid. When you can take care of people and you miss an opportunity, that's bad government. That's
Well,
why people,
my hat's off to Senator Whitley for doing such incredible work,
she worked hard.
taking the original bill and making it something that really solved a specific problem with, and it's an absolute shame that we didn't have more bipartisan support.
Well, maybe you can come
So
back.
we've reached the end here, Tom. It goes by fast. especially with an outstanding guest like you. We're very fortunate to have people your caliber serving us in the legislature. And
Well, thank you for having
And I think
me.
it was really wonderful you could be here, and it'll be our first guest of 2022.
Right,
And,
2022.
first Wednesday month, I have the pleasure to have you with me, and so this was terrific. So thank you so much.
Great to be here.
I'll be-
Great discussion.
I'll be interested to following what happens next.
Thank you so much.
Okay.
Happy New Year to everybody.
Happy New Year, everybody.
Right.
And we
Happy New Year.
leave an upbeat
I'll be back
note,
next week
right?
with Mike Farley, and I think we'll be having one of our people from our own Manchester Public Health,
Great.
either Anna Thomas
Right.
or Phil Lexicon. Those people are heroes.
Anna Thomas is a star.
Yeah.